So relax your shoulders, and then I'm gonna tell you let your head fall. So let it fall more.
I honestly don't know the difference between like a headache and not having a headache. Literally like taking over like my life. That felt amazing. That was the one. I felt that one. I just pulled like years of tension. I don't understand like when people want to take a nap after this.
You go first. I'm gonna have a seat. You ready? You said you were hurting, so tell me what's going on with you.
I'm feeling like a lot of tension. I've always felt a lot of tension like in my shoulders. Like that's kind of where I carry my stress.
Mm-hmm.
And then like around here in my lower back. Recently, I don't know if I slept wrong. I don't know what happened, but for like a week now, I've just had like pain, like just starting like up here, kind of going all the way down to my lower back.
That sounds awful.
Yeah. Yeah.
So neck issues, neck pain. How bad does it get? Scale from 1 to 10. 10 being the worst.
Probably like a 6, 7.
That's high though.
Yeah, and it's like constant. Like it doesn't go away. Like
so even right now we're talking.
Yeah, like I feel it like all through like in here and like in my lower back. Yeah.
You get headaches or migraines?
Yes.
How often are you getting those?
Headaches, I've been getting a lot ever since this started hurting. Migraines, it's like every once in a while, but when I do get them, they're so bad, like my head feels bruised the
That's
next
awful.
day. Yeah.
How many headaches are you getting per week?
So far, I just know like recently, like I've had a headache like every day just because of like the pain. But before that, I don't know like how often.
How often? Okay.
But I do have like I suffer with like anxiety and like stress and stuff, so like that causes headaches.
Sure.
So like to be honest, like as dark as it seems, like I honestly don't know the difference between like a headache and not having a headache sometimes. Like it's like I constantly am stressed.
So right now you have a headache.
Yes.
Right now your neck's hurting.
Yes.
All right. And you don't know what it's like to feel normal.
No.
When's the last time you think you felt normal?
I have no idea. I've dealt with like stress for like a very long time. It's getting to a point where like it's really like affecting my health. Like it's caused like psoriasis. I didn't know those had.
Yeah.
So that's something that just started this year. Like it's literally like taking over like my life. So
yeah. So we need to get you better.
Yeah.
You know. Yeah. I mean that's.
Yeah.
It's whenever it's like it's not even the pain. Like people can live through pain. I used to have pain and I could live through the pain. It's whenever it starts to transcend into your daily life and it's like affecting you and you can't do some of these things. You can't sleep. You can't even eat, like whatever. That's when it really becomes like a serious thing.
Yeah.
Right? Because I'm sure you're like worried about the future, you know?
Absolutely. I'm only 24, so.
Yeah, it's so young. You shouldn't be having all of this stuff.
Yeah.
So with everything that you're saying, you know, a lot of times what ends up happening is that the normal that you're supposed to be having isn't normal anymore.
Right.
Right. So you're made with straightnesses in your body, in your spine, and curvatures. And a lot of times we get off that. And when you get away from that, that's when you start to have a lot of these issues, right? Whenever you're stressed, even, you know, I get really stressed at some points too, but I don't have headaches. I don't have that type of things. But the reason why you start to have, you know, the headaches and you have the neck issues is because something's positioned in the wrong way to begin with. And then when you have stress, all the muscles tighten up even more. And then it impacts all their deficiencies, which just add to it basically.
Okay.
All right. So when I'm looking at the x-rays, what I'm looking for, all right, say this is you, we want a straightness in your spine that goes up and down like this.
Right.
Right. And then from the side, we want to have curvature. So we want a curvature in your neck that goes backwards like this. We have to see a curvature that moves backwards. That's where all the weight's being distributed evenly. Right. And your mid back, we want to have a curvature that goes this way, and then in your lower back, you want to have a curvature that goes like this. Right. And the thing is, this curvature, we need to bring it. If it's like this, so I want you to notice this. So if this curvature is there and there's a muscle that's behind here, say imagine that muscle back there is 6 inches, right? If that curve becomes lost and now it's moving forward, do you think that muscle still stays at 6 inches?
No.
No. It moves more like to 8 to 10 inches over here. And the thing is, the worst part about it is that it stays like that. this curve doesn't return until there's actual force done into that neck that allows that curve to be returned. I can get you out of pain, right? That's not, you know, and I say that very confidently, that's not the biggest issue. The biggest issue is making sure that you're staying out of pain. The way that you stay out of pain is to make sure that we start to get that curve back, right? And I was telling him, like, this first adjustment, you'll feel relief, right? But the thing is, there needs to be a continuation of it, right? So based on how bad this curvature is and how bad this lower back curvature is, that's going to allow me to see, you know, what we have to do with you. But we have to change a new normal for you, right? Because right now, the way that your body is not good, right? It only knows the wrong things to do, right? And it's trying to keep you, it's trying to be normal, but it needs help, right? So the reason why the follow-up visits are so important is because what we're doing is we're trying to keep that momentum going and trying to change your body so it remembers what to do in the right way. All right.
Seems like we went to the right guy.
Yeah. That's the main. I mean, listen, I've seen people that have come in here with 10, 20, 30, 40 years of migraines and headaches, right?
Yeah, I don't want that to be me.
You don't want, exactly. You don't want that to be you.
Terrible.
And it is. And they come in and they have all these surgeries done, and they have all these like crazy surgeries, and they've done the Botox injections, steroid injections, and it hasn't got them anywhere. And it's really because they haven't gone back to the root cause of the issue. So what I'm really trying to say to that is, yeah, don't let yourself get that way, but at the same time, we've been able to help those people, right? You're still young. 24 is still really young. Your body can still adapt and change at a much more rapid pace than those people ever could, all right? So we just got to keep on it, okay? So any questions from you guys? No? All right. I'm going to set up the x-ray room. I'm going to come back and grab you, and then we're going to do the x-rays, and then afterwards I'll show you the x-rays, and then we'll go from there, all right? So what I want you to do is you're going to keep this leg straight, and you're going to lift it off the table for me.
Like this?
Yep, as high as you can. Good. Go back down. Good. Do the other side there. Good. Do the other. That's good. Which one's harder for you to do?
Probably maybe this one. Yeah.
That one's harder. So we're going to adjust. So this table is going to come up underneath of you first, okay? And I'm just going to push in right here. Good. Any pain when I do that? So what we're doing is we're just pushing this hip back upwards.
Yeah.
Lift this back up. Good. Do the other side.
Oh my god. Yeah.
Better, right?
Yeah.
We're going to loosen these hips up, okay? And I'm going to turn your leg just like that, and then I'm going to push down just like this here, okay? We're going to go like this. One more. Good. Now lift this one all the way up again. Good. To the other side.
Beautiful. Go up higher now.
Yeah. Okay. Keep the bottom leg straight. You're going to keep this just like that, all right? I'm going to be pressing up here, all right? So this one was too far down, so we're going to be pulling this down this way. So I'm just going to put my hand right here, and I'm just going to keep you steady, just like that. Any pain when I do that?
It's just stretching.
It's just stretching?
Yeah.
Okay. So what I want you to do is you're going to take a deep breath in. I'm going to push just right here, okay? Good. So take a deep breath in and exhale out. Let your stomach roll more.
Okay.
That wasn't too bad, was it?
No.
That sounded good too.
Yeah. Go on the other side that way. Bend this knee just like this. Scoot all the way forward. Now this one is a little bit different, all right? Because we have to push in a little bit harder so we can actually rotate those back. So turn a little bit more.
Yeah.
You can feel that, right?
Yeah.
So I have to push on the side right there. You're okay?
Yeah. I just feel it. I feel it right
You
there.
feel it? It hurts?
Yeah.
Okay. So you're going to take a deep breath in for me. Exhale. Good. A little bit more. Take another deep breath in. Exhale. Let this hip roll down.
That felt amazing. Okay. Yeah. It's like a relief.
Yeah.
Yeah.
It's like things haven't moved.
Yeah. Okay.
Good. Alright, so we're going to adjust right up here. You feel that? So that's where that bend of that curve is. This one, you really just have to relax as much as possible. Alright. So you're gonna turn your head as far to the right as you can. I'm gonna put my hand right here, just like that. Good. So I want you to bend your head as much as you can. Good, now relax everything. That's good. So relax your shoulders, and then I'm gonna tell you let your head fall. So let it fall more, drop.
Oh yeah, I felt that one.
Yeah.
Yeah. Wow. That's like pain that I've been like feeling all week that I haven't been able to like, I guess, pop or, you know. Wow. Okay. Yeah. I felt really good. Yeah. Oh my gosh. Okay. I feel like I can like breathe more, if that makes sense.
Yeah, no,
Yeah.
that's totally normal. I mean, your breath, it comes from your lungs. All these nerves go to your lungs.
Yeah.
And when you're in this posture like this, you don't get any of that air because it's like pushing up against it.
Yeah.
All right. Good. So we're gonna adjust a little bit higher. Scoot down just a tad bit for me. That's it. Let your legs hang down. And so we're gonna go a little bit higher. So that mid back, right, it has that curve that goes off to that left side. So we're gonna be contacting from the left side and pushing back. All right. Ready? Yeah?
Yeah.
Okay.
You got a little.
So hold just like this. You're gonna roll with me this way. So it's on this side.
Okay.
Right? So right here. You're gonna roll backwards.
Ooh. Yeah.
Good. All right. So you just gotta let your body just get comfortable under off or around my hand. Good. There you go. So take another deep breath in. Exhale all the way out. That's it. More.
Oh. Yeah. Yeah. That felt good. It felt like it needed to happen for
Yeah.
sure. Yeah. Yeah. Okay.
Can you breathe a little better?
Yeah.
Yeah. We're gonna get a little bit higher now too. Okay.
Okay.
So one more.
Dude, when you do the.
Yeah.
Oh man, I know that was fun.
Well, so for women, right? It's easier for me to do it this way because if I do it this way, it's like I'm just pushing on their chest.
Yeah.
It never feels good.
Correct.
It's like don't do it.
No.
A little bit higher right here, okay?
Okay.
And so I have to push and go upwards, just like that. Take another deep breath. Let that air out. That's it. Good.
I felt like just one, like.
That was like a big one.
Yeah.
Big crack on one.
Yeah. Wow. Okay. So far, so good.
So far, so good. It wasn't so bad, right?
No.
So this lower portion, right where this is, I can feel a lot of tension in there. Is that pretty much where you feel that, right?
Yeah.
All right. So we're gonna get down here. Just like that. It's already moving. I don't have to do anything. Good. That's it. We're gonna turn to relax everything.
Yeah, that felt amazing. Yeah. Okay.
That wasn't too bad, right?
No, it wasn't.
Yeah.
It was great. I'll probably do that multiple times a day. That'd be great.
So lift your head all the way up and then let your head go down. Perfect. How does it feel when I do that?
That feels really nice.
Yeah?
Yeah.
Good. So I'm gonna give you a couple of openers like this just to get your body just relaxed.
I feel it like where my headache is. Like it's like, I don't know how to explain that. Like it's like stretching that area, I
Yeah,
guess.
so it's the occipital area,
Yeah.
right? So it's pulling and it's hitting that area. So we just have to break through a lot of that right there. This is a part of the reason why we do it right here. You okay? Okay. That's good. So just like that, just how relaxed you were right there, it's perfect. So I want you to take a deep breath in and exhale all the way out. Good. Take another deep breath in and exhale all the way out. Good. Relax everything. Good.
Oh, yeah. That was the one.
That was the one.
That was the one. Yeah. Oh my gosh. I feel like that one was just like, I just pulled like years of tension out of my neck.
So I tell people, if you want to get better, no matter what it is, start with the spine first.
Yeah.
And then start to work your way outside. Because if you're, you could have so many different things going on, and you can't treat everything all at once. What you have to do is centrally locate something first, attack that portion, see how much that affects you, right? And then start to work outside. How are you feeling?
I feel good. I feel, now I understand like when people want to take a nap after this. Like I just feel so relaxed. I've been losing like a lot of sleep because of like my pain. So like now I'm just like, all right, we're just gonna go catch up on all that.
Yeah, and this will be probably one of the best sleeps that you have because your nervous system just resets.
Looking forward to it. Yeah. No, I definitely feel more like relaxed. Like the tension that I was feeling through here, it's not like when I walked in.
Good.
I've been like annoyed all day because it was definitely hurting. And then like down here, I just feel like, yeah, I could breathe better. Like, I don't know. Like,
so awesome.
Yeah, I just feel more loose.
Good. How's lower back pain?
It's really, I don't feel it. I don't feel like it was throbbing earlier. And now like I don't feel it. Now if I press down, of course, but it's not throbbing. So that's a good sign. Even like stress, like I don't, like when I feel my stress, I feel it like all like through here, and I feel like it's much more like relaxed. So that last one is what, yeah.
What did it?
yeah. So yeah, I feel
that's awesome.